We are recording now.
Good afternoon, everyone. Thank you for joining today. We are excited to present our mock stakeholder engagement plan for Healthies, which is a healthcare application that aims to improve the overall healthcare experience. Joining me today would be my team, Akshat, who is the admin as well as the IT lead, and Anshuman, who is the doctor in-house, providing us his expertise and understanding of how the application works and any improvements required. Healthies is an healthcare application designed to simplify the appointment scheduling, providing easy access to digital medical records, and offering personalized healthcare recommendation to our users. Our vision is to create a patient-centric, technology-driven healthcare ecosystem that empowers every stakeholders. Akshat will be taking over to help us understand this better.
Yeah, just a brief overview of our stakeholders. We have identified the IT team, healthcare administrators, and doctors as the internal stakeholders who have high influence as well as high interest over this project. External stakeholders are patient with a lower influence and high interest. And key stakeholders are doctors and medical administrators due to their dual role in decision making and daily usage. Over to you, Anshuman.
Thank you, Akshat. So to effectively engage stakeholders, we'll tailor techniques for each group. Doctors and medical staff, interactive workshops, beta testing, and one-on-one gather feedback and address their concerns. Healthcare administrators, monthly strategy meetings, and compliance briefing to ensure alignment with the hospital goals. IT teams, clear documentation, technical training, and regular updates to handle beyond backend systems efficiently. And for patients, user guidance, 24/7 and regular surveys to enhance their experience and gather. Thank you. Over to Ishita.
Thank you, Anshuman. Let us look into our conflict resolution strategies by going through a conflict that arise due to the doctor's concern and looking into a role play. Thank you all for joining this meeting. We've gathered here to discuss a concern raised by Dr. Smith and his colleagues regarding the usability of Healthies. Our goal is to understand this issue today and to collaboratively find a solution.
Thank you, Ishita. So to start, I want to clarify that I'm not against the app. However, first feel it's adding extra steps to our workflow, taking time away from the patient care.
That's a valid concern. Could you maybe share specifics?
Sure. For instance, entering patient numbers into the app slower than our current process, and also navigating to multiple screens to order test feels cumbersome.
Thanks for pointing that out. From an admin perspective, we have certainly noticed delays in test orders, which could impact patient care timelines. But could you please provide me further info if they were observed during the beta testing or did they emerge after the rollout?
Yes, so during testing, we flagged some issues, but they weren't fully resolved. We feel our feedbacks wasn't prioritized.
I'm sorry to hear that, Dr. Smith. It is very clear that we need to address both the app's functionality as well as the communication around the feedback. So why don't we do a thing now? Let's brainstorm some solutions, and Akshat could help us simplify the interface for note-taking and test ordering.
Absolutely. We can streamline the note taking by allowing voice inputs. I think that should be done around 2 weeks.
Thank you, Akshat. So that would help, but until then, we need an interim solution. Could you assign a scribe or allow temporary use of old system for complex cases?
Certainly. I can definitely look into hiring temporary staff to assist with documentation work, but I'll need to evaluate the budget and resources. Please allow me a week or two to get back to you about that.
Sure.
That's a great suggestion. I agree. So thank you, Dr. Smith, and thank you, Akshat. If we can secure the resources, this should be a viable interim solution. Thank you once again all for your time. We will reconvene in a week's time to understand the progress. And in the meantime, our action items would include simplifying the app's interface by adding voice to text and streamlining the test orders. We would also be looking into hiring temporary documentation support as well as improving on our feedback loops to ensure that the concerns are addressed and updated during the updates. Thank you so much.
Sounds good.
That sounds good.
So, in conclusion, effective stakeholder engagement is crucial for the success of Healthies. By tailoring our approach to the unique needs of each group, whether it's doctors, administrator, IT teams, or patients, we ensure that all voices are heard and addressed. So our key takeaway is that ongoing communication, feedback loops, and flexibility are vital to maintaining trust and collaboration through the project. So thank you all for your time today, and we hope this presentation has been clear in helping understand our stakeholder engagement plan and its importance for the success of Healthies.